Hello, Justin Long. I'm the Director of Investment Advisory Services here at KLAS Research. Joining me today,
I'm Sean Howell. I'm a Senior Insights Director here at KLAS Research.
and most importantly, who is joining us is Dr. Yaa Kumah-Crystal. We're so grateful to have you with us again, and it's great to see you.
It is such a pleasure being here today. Thank you for inviting me.
Likewise, and I think we want to ultimately underscore your credentials first and foremost, and then we'll dive into some conversations. But currently, you're the Assistant Professor at the Department of Biomedical Informatics, and then practicing as a physician and over pediatric endocrinologist.
Yes, I get to be a geek doctor. I get to see patients, and at the same time, I get to play with computers and figure out how to help make healthcare better.
The best of both worlds, Dr. Yaa. So you have given us permission to call you Dr. Yaa, since we're now a little closer and you've participated in our last DHIS. So going forward, we'll call you Dr. Yaa. But Dr. Yaa, we've spoken before this, and it was so wonderful to see you in Park City at last year's Digital Health Investment Symposium in 2021. That is your first time in attending. I think maybe we would love to ask you first and foremost, what was your overall experience? Not only the beauty of Park City, but the event itself.
I'll start with the beauty of Park City. I think we were there just as the leaves were turning and everything. So it was just an amazing experience. The event itself, I just really didn't appreciate from the beginning what it would mean to bring all different peoples from kind of the different areas of medicine and have them all in one table having conversations about solving the same problem, and then being able to come up with kind of a bullet list of high points to focus on. And that was just a very different approach to other conferences that I've attended. So that was one of my favorite parts.
Yeah, it was. It's unique in that sense. And we've talked about kind of the unique ability of the event, right, Sean?
Right.
And you kind of addressed some of those. But in your years, you've attended a lot of events. I'm sure many more than we could even count. And we're not going to have you compare one over another, but I'd be curious, what was maybe unique or different at this event from just generally others that you attended?
I think the main focus on the themes and working to solve a particular problem. Generally, the conferences I attend are large conferences, and they're different sessions, and you have people present a topic, and then some people ask questions at the end, and then everybody goes about their day to the next session. But in these sessions, there was a lot of focus on just helping to solve a problem. It has to do with patient access to medical care, things to do with communication in medicine. And there were so many different players and stakeholders that it was unique to be able to talk to someone on the complete opposite side of the spectrum to understand what their barriers are with regards to helping patients access care, and then be able to speak to some of the things that we see from the patient perspective. So I think the roundtable experiences were very unique to the other conferences that I've attended in the past.
No, thank you for sharing that. Sean being a content lead, and that's something we really focus on, right, Sean, to kind of bring that intimate, diverse group together.
Absolutely.
Much of what Dr. Yaa had mentioned.
Yeah, absolutely. It really is a unique opportunity to have all of these different parties come together, their different perspectives, and we love taking that time to have them put their heads together, to dive into the problems, to try to solve them together. For me as well, that's a highlight, just seeing that take place. That's a highlight for me of DHIS. I was going to ask Dr. Yaa, as you're thinking about your experience and others who may be attending, from a provider perspective and others, what would you tell them as far as the main value that they can expect from attending DHIS? I
think there are other providers there as well, and being able to correspond with the other providers about some of the ways they manage workflow, some of the things they see with their patient populations was very interesting as well. Some of the academic conferences that I attend, you have an opportunity to discuss some of these things, but it's more in the context of specific disease states. But on a more higher level, kind of on an enterprise organizational administrative level, you'd had a chance to think through issues with like-minded people, and being able to speak to some of the vendors. And it wasn't just any vendors. These are the people who are kind of leading the space and the innovators, and just seeing some of the fresh ideas that they were bringing to the table to help think through how to get through some of the stickiest things that we're encountering, especially during the COVID pandemic, I think is something that as a provider, you don't necessarily see it. Some of the research conferences and things like that you go to. So the focus on the problems that you were trying to solve is very different and certainly more appropriate for people that are in positions where they have to think about dynamic approaches to some of the bigger problems.
That's a great point, Dr. Yaa. As you talk about these innovators, these high-level, really movers and shakers that are relevant in their respective spaces, right? But aligning them with ultimately what's happening out in the healthcare organizations and then in your day-to-day practices, right? Because sometimes innovation doesn't necessarily align with your priorities or care or budgets, delivery, all of those areas. So it sounds like you're feeling that ultimately is kind of a nice overlap or intersection to bring together those right parties to have maybe not tough discussions, but relevant, real-time discussions. Is that fair to say, as a summation of what you're saying?
Absolutely. And the people there all were really focused on solving problems. And everybody had a personal story and an anecdote of themselves being part of the process that they found inefficient or a loved family member. And to see people's kind of passion really driving the recommendations they were making was very important to see, and to actually know that everybody was not just a stakeholder from a financial perspective because they were a member of a particular company, but they really did care about making these solutions happen.
That's great. That's probably a great segue to the question I think we're thinking about asking Dr. We won't put her on the spot, but I'm sure she'll just nail it. I'd love to hear a response to this one.
So as you think about takeaways from DHIS, I would love to just hear if you can share a little of, since DHIS, which was in September of last year, are there any things that you've done differently or new approaches or investment in different solutions, basically impact in your practice from DHIS? Can you share a little about that?
Absolutely. A lot of the discussions around patient access, the digital front door, and being easier for patients to be able to reach the people they need and get to the appointments they need without having to go through all these hurdles really resonated with me. And we actually had a committee that shortly met after that that I led to say, well, let's really think through how easy or frictionless we can make the process and what the barriers are right now. So we actually have done a lot of work thinking about scheduling, the way we make open scheduling available, the way we make appointments more accessible to patients. And that was really motivated by a lot of the things that I heard coming from the conference. Some of the solutions that the vendors had proposed just really had me thinking about what are we doing now and what could be doing different. And I've had a chance to speak to actually some of the vendors that we met at the conference just to have kind of ongoing conversations about, well, what else exists in this space that we're not thinking about that we can use to make the experience better.
Wonderful.
That's great. What you ultimately shared, we've heard many times, and that's one of the key goals of DHIS, right? Is not necessarily just bringing a group together to network and make connections. Although that's important to many, but that opportunity to really get elbows on the table, as you said, maybe reinforce strategy or initiatives, but also for all unique groups, kind of unveil maybe opportunities that they're not considering or gaps to what our whole mission is, and you know this, Dr. Yaa, is to contribute to improve the world's healthcare. So that's why this is such an important conference of bringing great minds and innovators and leaders like yourself to this event. Sean, anything else that you feel like we need to ask Dr. Yaa here?
As far as questions, no questions. I just want to say thank you, Dr. Yaa, for taking the time to share about your experience at DHIS. We love hearing about that, and we loved having you there last year. It's wonderful. So we always appreciate being able to interact with you.
Well, thank you so much. I mean, I can tell that no small amount of work goes into pulling something like this off. And I just left so energized and ready kind of to take on some new tasks that before I found daunting, but just knowing that there's so many other people thinking about it and working to get it better and are personally impacted by it, just really drove new energy to get things changed.
Thank you, Dr. Yaa. No, it's been a pleasure, as always, to spend a few minutes with you. And we're hoping again in 2022. We're holding it in Park City. I think that's important to note. It'll be September 13th and 14th, Park City, Utah. So it has those fall colors. We hope it's as bright and beautiful as it was last year, and that day and a half event. So we're going to hopefully find a way that you're able to join us again for this year's event. For any that are listening to this today, that have been considering joining DHIS or participating at this year's event, feel free to reach out to your point of contact at KLAS Research, or you're welcome to go to klasresearch.com/events, where there's more information and detail specific to this year's topics and theme, as well as registration information. Dr. Yaa, we look forward to talking again soon with you.
Pleasure is mine.